Good morning. Hi, I'm Ace. I'm currently in my sketch form because I am the editor of the group. By the way, here are the group members mainly Dr. Quao David, Dr. Nika Gadaza, Dr. Mikmik Lalab, Dr. Sarah Lucas, and me, Dr. Aaron Andrenal. So as the title suggests, we would like to show you the proper way to conduct a medical interview using the integrated patient-centered approach. So, a little nutshell about this whole interview process. As doctors, we know that when conducting a medical interview, relevant information about the patient is a crucial factor to have and as a basis of diagnosis because a perfectly executed interviewing skills will lead to a right diagnosis and treatment. But in order to perfectly execute it, doctor-patient interaction needs to be largely influenced by the quality of relationship between the clinician and the patient. But how are we going to do that? Let's ask ourselves, how do we get that quality relationship from that person? Well, I think I found the solution. We need to do is that we need to obtain a certain amount of empathy in order to establish rapport. This is why we have the biopsychosocial approach model. So the biopsychosocial approach model is a multidisciplinary technique that involves catering to biological, social, and psychological factors in order to understand your patient better and give rather more solid treatment plan and outcome to your patient. Well, with that case, what's the goal? Okay, so the goal is to reach a shared expertise to your patient, backing it up with evidence. Also, you need to establish empathy, being sensitive to social cues, and realize the emotional state of the patient. And last, you have to be engaging. You have to engage to share decision making with the patients. Now, here are my colleagues, and they will present the 11-step evidence-based interviewing methods on what it would look like after a physician to apply the integrated patient-centered approach to their patient.
Ito umaga po, ako po si Nika Gadaza, isang estudyante mula sa UNP. Ito po ang aking mga kasama. Ako po si Nika Gadaza.
I am David Kwok.
So ako naman po si Sarah sa RCPA. Ano po gusto niyo i-out namin? Okay lang po ako sa Sasa. So, bakit po kayo nakapunta dito? Dok, kasi po nilalaman po ako 2 days na po. So, ang agenda po natin ngayon is na lunasan kung ano yung hinahingat. Opo, sana. Kasi parang makabalik na po ako sa school kasi nakakabagal na po yung absences. So, nabanggit niyo po na nakakaabala po sa inyo yung nalalaman niyo. Bakit po kaya? Kasi imbes po na pumapasok po ako sa school, nakahiga na po ako sa bed the whole day kasi hindi po ayaw makatawag talaga yung pagalaw-galaw ko. So, ano po ginamit niyo po pang sukat ng temperature niyo? Gumamit po ako ng digital thermometer po. So, ano po kataas yung nakuha niyo? Nung una po doon, nasa 38.7, gano'n po. Tapos tumaas po siya lalo. Pero, nung nag-take po ako ng paracetamol, bumaba naman po ng konti. Pero bumalik din po siya. So, sinabi niya rin po sa akin na 2 days na po yun, no? So, buong araw po ba kayo nalalagnat o sa bilang or buong araw po daw, buong araw po siya.
Okay, so can you describe the onset of symptoms that you've experienced?
Aside from the fever, Doc, during the first day of my fever, I also experienced pain during urination. And actually, it was difficult for me to pee too because I usually go and pee in the morning when I wake up. That's when it started hurting.
So regarding the pain, can you point where?
Actually, I have lower back pain like right here.
So when do you feel pain during the urination?
It usually is in the middle when I pee.
Then after that, you see like any blood or something?
There's actually no blood.
And also, does that make it like difficult for you to urinate?
Yes, actually, it hurts when I urinate and I have difficulty urinating too.
Then how has this impacted your daily life? Like, how has it been on your routine?
Actually, I don't have a daily life ever since it started because I just lay on bed the whole day because I cannot physically do anything because of my fever, because of my pain. So I just choose to stay in bed.
Okay, so let's dive into something related to how that came for you. So have you had any experience with UTI or
Go!
Okay, so I'm going to be requesting for UTI test. Then also I'd like to ask a bit about the past. What the general state of your health and also any issues in the past?
I've been okay, actually. It's just this one that I'm concerned about. That's why I came here for a consult.
Have you done any injuries or other procedures?
Not really.
About past hospitalizations?
Not that I can remember.
And do you recall of your medication history?
Oh yeah, I always ask my mom about that. She says it's complete ever since I was a baby.
So, regarding medications, any current medication?
Mm-hmm.
Those? About your MENA, puberty,
Excuse me?
MENA,
Oh, I think it started when I was 12 years old.
and based on your lactation, how is it feel like? Regular?
It's regular.
So everything's
Yeah, everything is normal. It's just this one, this fever, and the pain, it's just killing me right now.
okay. So regarding the pain you said at your back, I'm going to be doing a test to assess that. It's called a match test. So I need to cooperate with me. So what will happen is that I'll place my hands at your back to work out. Then I'll make a side punch. Then you let me know or show action if you feel that the tense pain there. Is that okay with you?
Okay.
So I need you to let me know if you feel the pain. Okay, on the other side. Okay.
So, ito naman po ay interview ko kaya ano sa inyong social history. Tama ito po yung beses na nakakonsulta kayo sa akin. Oh, okay. So, itanong ko po, nagtatrabaho po ba kayo? Yung university? Estudyante. Okay. So, kamusta naman ang diet mo? Mahilig ba sa vitamis? Medyo po. Maalat. Magaling mga toyo, pati hindi po. Matataba na pagkain. Dito, ginataan. Hindi rin po. Hindi rin. Kamusta naman ang physical activity? Nag-exercise ka ba? Lakad-lakad lang po. Lakad-lakad lang. Okay. Gano'n ka rin ka madalas na naglalakad? Ano na po, galing po ng dorm hanggang school. So, mga 5 minutes po ka lang. 5 minutes. Okay. So, ito naman po sa natanong, feeling mo po ba ay kayo po ay ligtas sa inyong lugar, sa inyong dorms? Oo naman po. Wala naman po kami pinag-direct or threat sa inyo. Wala naman po. Okay, that's good to know. Tapos, madalas ba magkaka-check up? Hindi po. Okay, so pag may nararamdaman ng minsan, doon na magkaka-check up. Wala yung mga annual? Wala po. Wala. Okay. Meron po ba kayong mga alagang hayop sa bahay? Wala. Sa dorm? Wala po. Tapos, nagtatravel po ba kayo? Hindi pa actually, dorm school lang po. Dorm school lang. Tapos, itanong ko lang din kung kayo po ba ay may partner or kayo pa ay sexually active? Wala po. Hindi. Tapos, kayo po ba ay kumagamit ng alak? Ay, umiinom ba kayo ng alak? Hindi po. Hindi. Or, ito po ay sa akin lang, hindi ko po ito pwede sabihin sa iba. Kumagamit po ba kayo ng mga iligan ng mga droga o iligan ng mga droga? Tapos, kamusta naman po ang relasyon po ninyo sa inyong pamilya? Meron po ba kayong conflict sa inyong family? Wala naman po kami. Stress sa life? Meron ba? Sa school lang naman. Stressful ba kayo sa school? Okay. O sige. Tapos, ang sunod naman po na itatanong po sa inyo ay tungkol po sa inyong pamilya. So, kilala naman po or nakakasalang ka naman po yung lolo, lola, magulang? Lola ako pa tayo. Pero lang po. May alam po ba kayo nasa kapatid ng lolo, lola, sa father side, diabetes, hypertension, tuberculosis? Wala naman po. Sa mother side po naman po. Wala. Meron po ba kayong alam na sa kapatid ng nanay? Wala po. Hindi po wala. Sa father side? Wala. May kapatid po ba? Wala po. Okay. So, maliban po sa inyong sinabi po sa akin mga kasama na fever, masakit po yung inyong report, at ako hirap humingi, meron po ba kayong iba pang sakit na nararamdaman? Hindi po naman po. Nasa sa kasukasukan? So, dito na po natatapos ang ating interview. So, mag-decide po ako mag-discuss po kung ano po yung mga napag-usapan po natin. So, base po sa inyong nasabi, mukhang meron po kayong acute thyroid nephritis. So, ito rin po yung base sa nakuha po resulta mula sa limit sa inyo ni Dr. Wang na urinalysis. Okay? So, ang gagawin po natin dito, kayo pa iinom po ng antibiotic, yung po amoxiclav. Okay? 2 beses po sa isang araw po, isang tableta for 40 days. After po man, mag-urinalysis po ulit tayo. Okay? Tapos, so far, kung naagapan na po natin ito, hindi po pa ulit ang inyong pagkakaroon po ng UTI o yung sa inyo po na nararamdaman sa inyong pag-ihi, hindi naman po ito mabilis o madalas na po hindi po ito nakaka-apekto na ng malalas sa kidney. Okay? So, meron po ba kayong mga katanungan pa sa amin? Wala po ba? Clear naman po. So, paano po pwede po ba ulit sa akin sabihin kung paano po yung gagawin po ninyo? Ano mga iinom na gamot?
Okay, so what a wrap. That's actually a great presentation. So to recap of the 11 steps, so let's start with step 1. It's setting the stage. You try to introduce yourself, address the barriers to your patient in order to communicate better and ensure the comfort to put the patient at ease. And next, let's go to step 2, which is elicit a chief concern or complaint and set an agenda. You try to indicate the available time, obtain a list of all issues the patient wants to discuss, specific symptoms, requests, expectations, and try to help and understand the patient. So next is step 3. We begin the interview with non-focusing skills that help the patient to express his or herself. And step 4, use focusing skills to elicit 3 things like symptomal stories, personal context, and emotional context to get a grasp of what he's really trying to say about his symptoms. And step 5, transition to middle of the interview. What do you mean by transition? You try to ask for a brief summary, check the accuracy if all the information given is true, and inquire if the patient is ready to move on with the interview, if he or she is feeling okay. Next one is step 6. You complete a chronological description of history of present illness and other active problems such as HPI and OAP. Step 7, you try to know the past medical history of the patient. Inquire the general state and their past injuries. Step 8 is their social history. Learn about who they are and who they interact with. Next one is their family history. Try to assess the problems through the roots with their family history. It might be genetic in causation. Last one is step 10. Review the system and ask about other active problems and concerns. So by the end of the interview, you should share the information, assess and understand if the patient understood everything that you say about your diagnosis. So yeah, that's it. Thank you so much for watching this video. I hope you enjoyed it and you're well informed about everything that we've talked about here. And as always, stay hydrated and stay healthy. So bye!